I was initially wanted to be an infectious disease doctor and did a lot of research on virology and wanted to study HIV. And I started doing my medical school rotations and realized that internal medicine just wasn't for me. And so I started doing a lot of electives, searching for the right fit, and stumbled across neurosurgery as a 2-week elective and kind of fell in love and been doing it ever since. Case-wise, neurosurgery is a very tough sport, and that's part of the reason that it attracted me. You're dealing with very critical situations, very sick patients in many cases, and that was borne out very quickly in residency for me, and I think that's really what kept me interested in and has kept me interested in it over the years. Patients do better when they make their own decisions about what's right for them. It's hard for me to say what's right for any particular person. I'm not in their shoes. So my job really is more about educating them about the options and what I think are reasonable options as opposed to not reasonable options, and then allowing them to make a choice of what the right way to treat their problem is. Sometimes the best surgery or the textbook surgery is often a very large operation, which may or may not be something that they could tolerate. And sometimes we have to do a lesser or unconventional operation, or perhaps think a little bit outside the box on how to manage their symptoms or their problem. And sometimes just laying that out helps them see what their options are. I've had patients that are sent to me that are extremely old, in their 80s, and been told they need a deformity correction for a scoliosis, which is a massive operation. And I just don't think they would tolerate that. And sometimes we have to think outside the box for other options for them. Mostly I'm running around after my 3 little kids, so I don't do a lot other than that outside of here shuttling people to soccer games and baseball games and tennis matches. But outside of that, I like to read. We like to travel a lot, so we're kind of trying to create world travelers out of our little kids, as well as see all the sights around the world, and that's kind of our big hobby right now when we're not here.